It's Michael Kagiri. I'm going to be doing a neuro assessment video. I have my patient identifier here. I'm going to wash my hands. And please verify your names for me.
Irene,
And your date of birth.
9/21/77.
Perfect. 2 patient identifiers have been identified. What I'm going to do is ask you to read the video release statement. At the same time, I'm going to do a 360 scan for the room.
I, Irene, volunteer, give Maryville University permission to record my image and or voice and grant Maryville University all rights to use this recording in any medium for educational or other purposes that support the mission of the university. I understand that the following information will be gathered by a Maryville University student as part of their course assignment. I give my express consent for this information gathering and physical assessments to be filmed and posted in the student course shell for access by faculty and students at Maryville University. I further acknowledge that since the recording is for education purposes only and the information is not meant to be diagnostic, therefore Maryville University, their faculty, the staff, and students are not considered liable. The recording will be deleted by the student in any of their devices as soon as it has been reviewed and graded by the instructor.
Perfect. Video release statement has been read. So we're done with that. Put that away. All right, so we're gonna start the test. All right, beginning this test after I already washed my hands, introduce myself. I'm gonna start the test. We're gonna start by checking the cranial nerves. All right, with this one we're doing the cranial nerve 1 through 10. We're gonna start with the olfactory. I'm gonna ask close your eyes for me. All right, once the eyes are closed, I'm gonna ask you to smell this. Let me know what you smell.
Lavender.
Perfect. All right, so that's done. We're gonna do the optic nerve. I'm gonna ask her to on this line here. Close your right eye for me. Just cover it up. All right, with this one, read the smallest line you can see here for me.
TEVUILA.
All right, switch eyes. All right, with this one, the smallest line you can read.
TUILA.
You go from here to the end. Perfect. All right. With that, we're checking, that's the optic nerve. We're checking smallest line they can read. Check the visual acuity. With that, we're going to do cranial nerve 3, 4, and 6. We're doing the oculomotor, trochlear, and the trigeminal. With this one, we're checking for extraocular eye movement. What I'm going to do is ask you to, with my finger here, all right, just follow my fingers for me without moving your head. Up, down, up. Perfect. All right, any pain at all? All right. I'm also going to check for pallor with this one. All right. I'm just going to check how your eyes are reacting. Close that out. Open your eyes for me. All right. Look at the light. Perfect. All right. Guys, for this one, I'm just going to do the same. Open up your eyes for me. Look at the light for me. Perfect. And also, we can check. Also, we can also check for accommodation. How far you can see. If you look this right here for me. Look at the side, and then look up there. That what the dot's at. Perfect. All right. Look here. Look at the side. Perfect. We can see that eyes have normal accommodation, both for distance and for near. Also, with this one, we're gonna do a check for facial sensation. All right, and jaw movement. So, do the whisker test. All right, I'm gonna ask you to close your eyes for me. All right, and let me know what side of the face I touch.
Right.
All right.
Left.
Right, perfect. All right. Now I'm gonna check ask you to open up your mouth for me. All right, we're checking for the soft palate. All right, open up your eye. Stick your tongue out for me. Say ah.
Ah.
Alright, let's check for gag reflex. Alright, perfect. That one is active. Alright, so after that, what we're gonna do is check due of distance, and we're checking for hearing. Alright. This is just a whisper test. What I'm gonna do is ask you to close your left ear. Here. Alright, I'm just gonna whisper and let me know what numbers you hear.
5.
Alright, perfect. Go ahead and come this to the side. Switch hands. Alright. Same thing.
9.
Alright, perfect. So now we're doing the whisper test to be able to check to see the hearing on both sides. Alright. The next thing I'm going to do is check for confrontation, which is also part of the eye movement. I'm going to ask for the 6 gaze or so. Look at my finger here. I'm going to ask you to follow this to all the 6 sides. Okay. Nope, just your eyes only. Nope. Alright, cool, perfect. With this other one eye. Alright, as far as you can. Alright. I'm going to ask you to keep looking forward, looking at this, and let me know when you can see this other finger here, okay? Perfect. Alright, also with that, we're checking also for the peripheral vision. It's part of the cranial nerves to be able to see the peripheral vision of what we're doing. Alright, with some we're going to check also, we're going to do the vagus nerve, cranial nerve 9 and 10. We're checking for the gag reflex. We did that, but we're just going to repeat for this particular test here. Alright, so I'll ask you to stick your tongue out and say ah. Alright, and just yawn. Looking for the soft palate, looking for any deformities, make sure it's complete. Alright, time depressor, stick your tongue out for me. Alright, perfect. Cool. With that done, next we're going to just check for the spinal accessories. Cranial nerve 11. What I'm going to ask you is shrug your shoulders up, down. Any pain? Alright, move your head up and down, left and right. Okay, any pain? Alright, up and down. To your chin. Any pain? Alright, with this one we are done. We did check for cranial nerve 12, the hypoglossal. Well, we did that tongue. We're checking for symmetry, so stick your tongue out for me as far as you can. Alright, move your tongue out to the left and right, lateral sides. Alright, perfect. With that cranial nerves being done, we're going to do coordination. With this one, we're checking for the upper extremities. We'll do the fingers, we'll do the elbows, and then we'll do the lower extremities. Alright, perfect. With this one, what I'm going to ask you is put your hands out for me. Alright, with the elbows up, we'll do the fingers as fast as you can. Alright, and then put your palms up. We're going to check for the flexion. Stick it, put them out as fan as you can, and I'm going to try and put them together. Any pain? Okay. I'll do the same for the other one. Alright, perfect. Same thing, we'll keep your hands up. And with your wrist, close your fist. Alright, I'm going to try and push them up against resistance. Alright, same thing. Alright, any pain? Alright, I'm going to try and bring this inside. Alright, out. Perfect. Ask you to do your elbows. You put them up 90 degrees. Alright, with this one, what I'm going to do is try and now flex them. Push them up, okay. Out and push them in. Don't let me push them in. And don't let me push them out. Perfect. So that's also checks for strength and reflexes on both sides. What we're looking at now is just, we're going to go to check the balance and gait. Alright, I'm going to ask you to, from sitting position.
Sitting? Okay, move cut.
Yes, from sitting position, we're going to start by checking the reflex. So stand with that using your hands. Alright, let's check the knee reflex. Then from there, I can ask you to move to the corner there. Alright, ask you to turn this way for me. Ask you to check your gait assessment. I want you to go with the chins down, like this. Come on, move forward. Okay. Alright, you can turn back. And then now I want you to go with the heels first. With the toes first, yep. Alright, come back. center. Okay, and standing right there, I want you to go ahead and flex your knees all the way down. Okay, any pain? All right, perfect. All right, ask you to sit down. And then we're going to do the chin to heel test. With this one, I ask you to place your chin on your heel on your chin and run all the way down. All right, same thing for the other one. All right, perfect. So without we inspecting for any problems or any coordination with that, next what we're going to do is go ahead and check on the thighs, and we're going to check on the strength of that. All right. So with this here, what I'm going to ask is I'm going to push down on your thighs. I want you to try and push up against resistance. Go ahead. Pull up. Okay. Same thing. All right. I'm going to do the same. So with your feet up, down. Okay. Down. All right. Perfect. All right. With your knees here, we're going to check for reflexes. I'm going to don't let me push it down. Okay. All right. Same. Down. Okay. Perfect. With this, we're going to check the ankle, dorsal, plantar flexion. I'll ask you to push like you're pushing on gas. All right, let me hold your feet. Push it like you're pushing on gas. All right, this is on. All right, in opposite direction. Perfect. Perfect. So with that, we're checking for the strength of the ankles and how she's able to grip with that. The other thing that we're doing after assessing that we're going to assess the flexion and extension of the hips. All right, so I ask you to stand up for me. All right, so with this, we're checking the hip movement. What I'm going to ask is bend from right to left. Okay, and you're assessing that for the pain. Also, I'm going to ask you to, with your leg, try and flex it as far as you can. Okay, and the other one. All right, perfect. All right, after we assess that, I'm going to ask you, you can have a seat. All right. After checking the hip flexion, we already assessed the gait, assessed the knees already from the sitting position. We did that test already. Next, we was going to assess the dorsal flexure for the ankles. We already checked that. The only other thing I'll ask you is like to step down like you're on the heels. All right, any pain on that? All right, and then do the heels. All right, two steps, up and down. Okay, any pain?
No.
All right. So with that being done, we're going to check the sensory. With this, we're going to test with the light face and on the peripheral of the face and see how that works. All right. Light touch. Let me see where it is. I got a tissue here. All right. Close your eyes for me. All right. Put your hands out for me. All right. Let me know if you can feel this. Is it right?
Yeah, the same.
Yeah. Feel the same?
Mm.
All right. With something a little sharper. Same thing. Let me know how you feel.
This side. This side.
Okay. Gonna do the same for your feet here.
This side. This side. This side. This side.
Oh, perfect. All right. So with that, we're checking sensations on both sides on the sensory systems. All right. So she can be able to just make 2 points if it's sharp or it's dull. All right. After this, we're gonna assess the biceps. With this test here, ask you to stick your hands out for me, palms out, and we'll just check for the reflexes here. All right, so right there. All right. Guess she has a very reactive reflexes. So you're feeling for the radial pulse. All right, perfect. The same way we're gonna check the other radial now, the arteries here. Same thing. Should be right there, reactive. Same thing on this other side. Show tendons. All right. And same thing, we'll do that. Same thing with the knees here. All right. You can raise your legs up a little bit.
Oh.
Up, the other one. All right, you can see the movement from there. All right, very reactive. That's checking for the reflexes. All right, next, I'm gonna assess we do the knee jack movement. After that, we can do the ankle. We'll hold the patient's foot, and then we'll be able to do that from there. All right, good. Same thing. All right. All right, perfect. They're both reactive. All right. After that, we're done. We're gonna do the last test. Will be the Babowski test. This checks for the neck reflex and for right and left. So for that, I'm just gonna ask you to push your leg all the way up. Okay. Yes. And all the way down. All right. You having any pain on the back here? All right. Perfect. But to do it perfectly, we can ask you to lay down flat. All right. With this test, we're going to check the knees. I'm going to raise your knees up for me. All right. Flex. Bend. Right there. All right. With this test, okay, let me bend it from 90 degrees. All right. With this test, I'm going to ask you to push up. Any pain? All right. Perfect. Do the other leg. All right. Perfect. So with that one, you can have a seat. It does also check the meninges for something like meningitis. If patient having pain, then that tells us there's something abnormal about that. All right. And this concludes my test for the neurological test for the patients. And that's it for the test today. Thanks.